Hello imposters, welcome to our second case in this collection of high-yield USMLE cases. Let's get started. Our case today is a 23-year-old woman who's presenting to the emergency department with a 4-day history of abdominal pain and vaginal discharge. She is sexually active with multiple partners but does not always use protection. Her menstrual cycles have been regular at 27 days long. Her temperature is 100.7 Fahrenheit. On physical examination, her abdomen is diffusely tender without rebound or guarding. Cervical motion tenderness is also present. Lab findings are as follows. The white blood cell count is 11,000 and the beta HCG test is negative. I have also included the lab values here if you need that as well. You can pause here before I show you the answers on the next slide. The diagnosis for this patient is pelvic inflammatory disease due to Neisseria gonorrhea or a chlamydia infection, or possibly both. Some things that should have gone off in your head are the systemic signs of her fever here and her abdominal pain and vaginal discharge. Fever is one of the best signs to tell if someone's immune system is activated. If they do have fever, it kind of indicates that the patient probably has an infection somewhere. Cervical motion tenderness is also present here, and that's a pretty high yield wording for PID. The white blood cell count here is, although it's kind of on the upper end, but it's still normal. The fact that it's kind of on the higher end of normal indicates that there's a little bit more white blood cells than usual, and it could indicate an infection as well. Some risk factors to keep in mind are multiple partners, unprotected intercourse, smoking, and also IUDs. It's actually the first 3 weeks when the IUD is placed. That's when the patient can be at a risk of getting PID. The goal for treatment here is to overtreat instead of undertreating. And what that means is you want to basically cover both Neisseria gonorrhea and chlamydia. So that's the reason why we use ceftriaxone and azithromycin or doxycycline. So you want to cover both organisms. Here's our visual slide. Here's the general anatomy, and PID is basically when the bacteria creeps up here and goes to anything past the cervix. So, that could include obviously the uterus, it could go into the fallopian tube, and it can even go into the ovaries. This makes sense with the complications for PID, which are infertility, ectopic pregnancy, and chronic pelvic pain. These complications make sense because, they can infect basically anything above the cervix. And in regards to ectopic pregnancy, the reason why that can happen is when there's an infection here, and let's just say that the patient was treated and they recovered, there could be some scarring in this fallopian tube. And when things start to migrate and try to implant for a normal pregnancy, that scarring can cause an ectopic pregnancy there. Discharge, of course, can vary woman to woman, and what is considered normal can vary as well to each person. This swab was taken from a patient with mucopurulent cervical discharge. Lastly, I have Neisseria gonorrhea and chlamydia for some micro review. You can see the neutrophils here. Here's a neutrophil, here's a neutrophil, and the little dots here are the pathogens from Neisseria gonorrhea, and you can kind of see that they're intracellular within the neutrophil, and they're kind of outside here as well. In chlamydia, we can see the high yield inclusion bodies in the infected cell. I'm not exactly sure what infected cell they used. These brown bodies are the inclusion bodies, and fun fact, the reason why they show up as brown is iodine binds to glycogen in chlamydia. Here's our summary slide, and today's topic was pelvic inflammatory disease, Neisseria gonorrhea, and chlamydia, and within the realm of reproduction and microbiology. The first 8 pages are 185, 142, 148, 184, 125, and 681. The high-yield munchies for this case is pelvic inflammatory disease is a complication of bacterial infections that spreads beyond the cervix. The most common bacteria infections include chlamydia and gonorrhea. Presentation can include pain, discharge, fever, and abdominal pain. It's better to overtreat than undertreat the patient. Primary treatment includes ceftriaxone and doxycycline. Complications include infertility, ectopic pregnancy, and chronic pelvic pain. That's a wrap for this case. Let me know in the comments section if you have any questions or comments. Thank you so much for your support and liking the video and subscribing. I'll see you in the next case. This is Imposter Med signing off, and as always, be happy and be kind.